My name is Lori Zapfe. I am a registered nurse, and I am a associate manager in the worldwide medical division here at Baxter with over 30 plus years of healthcare experience. So with the hospital flow and changes over the last few years, we have seen an increase of additional boarding in our ERs. We've also seen that throughput throughout the hospital being decreased due to a number of licensed beds not being staffed. I think innovation could definitely help for those boarding patients that are in the ED, but also throughout the hospital in general, just getting that throughput. We all know that boarding and hallway medicine has been around for years in the ED space. What has changed has been the last few years with the boarding crisis, and what that definition of boarding is. It's somebody that has been given an admission diagnosis to the hospital, but is waiting for that inpatient bed. And usually it's several hours extended in the ED space for that boarder. The hallway medicine is a little bit different, where we are bringing patients back when the patient rooms are full in the ED, and we have hallway beds or recliners, as we might call vertical care, to accommodate some of those patients that don't need a private room, but they would get their assessment done in the hallway, get their treatment, and then be on their way. That is something we're not proud of, but when we talk about overcrowding and things, that's something that we have to do to keep the flow of the emergency room going. So when we talk about overcrowding and how that relates and boarding to the financial piece, there is some things we have to think about. When you're having the boarding patients, it's almost double the amount it costs to care for those boarded patients within the ED space. So that's an increase in cost possibly to the customer, the patient. And then if you're boarding patients, there's no room for new revenue to come in, right? You can't be bringing more patients into the hospital if the hospital is at full capacity. So there are some challenges within that hospital system. So if you think about the cognitive load of nurses in the hallway and what happens with patients while they're in the hallway beds, nurses are constantly moving within the ED space, whether they're coming from one hallway to the next to the nurse's station. And you have hallway patients. So as you're going to complete a task, let's say you're going to drop off some blood work for a patient that you just got blood work on, and then you get stopped by that hallway patient and asked to do something else. Your brain can only take in so many things at once, so many tasks. Oh, there's somebody that's calling you on the phone, and it can just be a nightmare with all the different tasks coming at you from one point to another, which then can lead to communication errors with your staff that you're not used to talking with, and also just medication errors in general. Some of the things we've seen over the years with the increase in boarding is just stressful situations for staff that they're not used to. For instance, having patients that you have to take care of on a daily basis where you're typically treating and then having them discharge. There's some moral issues with clinicians in the ED space, having to give medicine to somebody that doesn't necessarily need it, but because they're being boarded, they're having to give additional medicine. So there are some increased stress. And then, of course, the patient satisfaction is just not there when they have to lay on a stretcher for hours waiting for a bed. When they don't feel well, they can't go to the bathroom by themselves. They can't do anything without calling for assistance. So it's definitely a challenge today. So today, the product innovation and again, I go back to some of the technologies. If you're boarding patients in the ED, in the emergency room departments, you need to be able to be up with what's happening in the other units, in the other realms of the hospital. So really, the durability is what's important with every medical product that we can get our hands on. We want to be able to use it for as long as we can. So I can say with some of our modern medical equipment today, it's simply just modern. I think we have some room for some advanced technology and some advancement with how things are done in the healthcare setting. Really getting out there and talking with the clinical staff that uses the product is what's important. So I think really engaging those caregivers that are using that product are what's important, because then you're going to have a overall better product because you've actually engaged those clinicians that's using that product. So I would say for the emergency room department especially, the tool that I think would be exceptional would be one that would provide support throughout their entire shift. and not break down. And it's built for anything. So built for the toughest situation that you might be in when it comes to the emergency department.